Okay, so it's the 16th of May today, and we have come outside Parliament to support a demonstration revolving around the assisted suicide bill. Now, the assisted suicide bill is incredibly concerning because it's an attack on vulnerable people. There are individuals, for example, if you have anorexia, who could be pushed in the direction of taking their own life because of the fact that they are apparently so ill they can't get through that. That is incredibly concerning. There are so many nuances to this bill that aren't being discussed. There is a complete lack of public consultation. There is a complete lack of democracy. Once again, we're seeing things rush through in a post-lockdown environment where we've witnessed the medical industry, our government, behave very unscientifically and very undemocratically, and we're just seeing more of the same. So today we're going to support this demonstration, and we're going to get the opinions of the general public and those that are here.
This is a government, or this is a society where we couldn't manage lockdown. We condemned thousands of elderly people to death. We forced everybody to have an experimental vaccine. There was huge social pressure put on people to take useless measures like wearing masks. I wasn't allowed to walk my dog. We were absolutely micromanaged within an inch of our lives and fed incorrect information. And yet we are going to trust this same society, this is not me saying I mistrust doctors, I don't, but we're going to give this same state the power to decide who lives or dies. I mean, what could possibly go wrong? And one of the things that really frightens me about this is that even if you put on your medical records that you do not want to discuss assisted suicide with your doctor, they are not bound to follow that. So at any point, a doctor will be able to raise assisted dying with you, assisted suicide, as many times as they want. It doesn't matter if you've got an eating disorder. It doesn't matter if you've got a mental health condition. Chillingly, if you've got Down syndrome, if you've got autism, if you've got learning disabilities, a doctor can raise the prospect of assisted suicide with you as many times as they want, completely unprompted, even if you've got on your record that you don't want them not to.
And what are your concerns about this bill?
So Disability Rights UK is a disabled-led organisation. We're here with other disabled campaigners today. People have often tried to make the distinction in this bill between those who are terminally ill and those who are disabled, but actually those groups significantly overlap. Disabled people are more likely to become terminally ill, and as per the Equality Act definition of disability, those who have terminal health conditions are also disabled. And we're really concerned particularly about the safeguards of this bill. They were already weakened throughout the committee stage. It's gone from a High Court judge approving an application to a panel of professionals with no clarity on how that will work, no obligation for those professionals to meet the applicant, no process for the family to appeal the decision if they fear that they've been coerced. Lots of amendments were voted down that would have attempted to give additional protections to some of the most marginalised, including prisoners and those who are homeless and children, and particularly those who feel like a burden or were seeking assisted dying for the benefit of someone else, which we need to remember that this is a backdrop at the moment of £9 billion proposed in cuts to disability benefits from the government. Disabled people are made to feel like burdens every day, and we are not assisted to live in this country. So how can we responsibly be assisted to die? But particularly for a bill, as I say, that is this inadequate and has been this rushed through a private member's bill rather than government proposal means there's a lot less time for scrutiny, and it's really concerning for us.
And why are you here today?
I'm here today because the narrative that's being spun about this bill is that it doesn't involve disabled people, but it absolutely does involve us. The amendments that were written up that would have protected us, that would have protected people who felt like a burden in society, they were all voted against. And it's a big threat to our way of life. It's a big threat to the disability community. And I think just the fact that the impact assessment was even released, showing how much this would cost, it's just really frightening that that's how we're being seen as. And I think in general, disabled people, we should be looking at accessible transport, accessible housing, making education systems more accessible and inclusive. We shouldn't be looking at something like this. And the bill doesn't include any type of right to good palliative care. We should be fixing palliative care before we even have this conversation.
I am here today because there's no more important or dangerous or reckless parliamentary bill that's gone through Parliament in my lifetime. This bill is an anathema to suicide prevention, to the very principles of social care, palliative care, the benefit system. Not only are we, for the first time, arguably amending the Suicide Act to make it possible for practitioners to end to participate in the ending of somebody's life. What we are also doing, in my view, is giving people assistance to die before they have assistance to live. And when you do that, because it'll be quicker to die than it will be to get a care package for the benefit system, the benefits you need, what you are doing in no uncertain terms is creating another discrimination. You are saying, in principle, that there are people's lives you value more than others. And what you are also doing is predetermining medical condition over the inequalities in society. What you are saying to me, because I was born with an incurable condition, is that my life cannot be full of joy, cannot be full of purpose, and that is why so many people with disabilities are so scared of this.
And what would you say to someone who says this is about, autonomy and people dying in pain and, I don't know how many people is a day, maybe 5 people a day die in pain. There's massive issue, we need to solve it. This is the way forward. What's your kind of response to them?
My response first and foremost is that actually we need to fund public services to effectively support people at the end of their lives. So many of our hospices in this country are funded by charities because the state fail to fund those public services. They chronically underfund the health service. So actually we end up in a much more uncomfortable and difficult position across our lives when trying to access healthcare, because there are so many barriers to accessing that. And I would say that this isn't about, us here today saying that we disagree with choice. It's that we are concerned that in practice, in particularly an ableist society that violates disabled people's rights every day, that this bill will limit our choices rather than expand them.
A lot of people you talk to have really no idea that the bill even exists. I think that's the same with a lot of bills that go through Parliament. And significant bills like this one, should be really brought to the public's attention much earlier. And so I'd say no, that I don't think there is the public scrutiny that it should have.
And what would you say to someone who's on the other side who says this is about, dignity in dying, stopping people dying in pain? What would you say?
I would say scrutinise the bill, because the fact that it's been done as a private member's bill means that it doesn't have as much scrutiny, and that's already a massive concern. It's a devastating bill. There's been new amendments coming out. There only a few days ago we got another 54-page document with amendments and changes. The element of coercion is very strong. The fact that it would just be a doctor having an online coercion test, anyone could do that. So I think just the lack of just clarity and protections for disabled people is the biggest concern that we have, and there is no right to palliative care, and that is what we should be really looking at. And we need to stop talking about disabled people as vulnerable people. Disabled people are some of the strongest and biggest fighters I know. We have to fight for our rights every day, and we shouldn't be having to fight against this.
I'm here to show opposition to the assisted suicide bill. Like a lot of us disabled people who know that the line between being terminally ill and just sick or just disabled is very thin. And the fact is this bill doesn't have the proper protections to prevent vulnerable people from being coerced into using it. They voted down protections for people with anorexia, with the lack of legal capacity to consent, prisoners, homeless people, children, people with Down syndrome, on and on. And whether or not you're in favor of assisted suicide in general, this bill is not the way to do it.
What's the consensus amongst other young people, like other students? Have you spoken to other young people about this? Yeah.
That's a good question.
I would say that amongst my friends, just anecdotally, I think there's not, a lot of people don't know about it. They don't know what the bill is. And then when I've explained to some of my friends who maybe agree with assisted suicide in principle, which I don't, but they agree with it in principle. When I've explained the bill to them, they're worried that it's dangerous and there aren't safeguardings in place. But I don't think people are aware of it.
A lot of people I've talked to aren't aware of the bill or what it entails. I would say once they've looked into it and have had a look at what the bill actually means and how that could be dangerous, a lot of people have then said to me, oh yeah, actually I'm quite worried about this. Even if they do believe in having a choice, they don't think that this is the right way for that to happen.
My message is that we all want the end of someone's life to be peaceful, but there's clear ways to do that through palliative care. The number is very few in terms of those who get the appropriate palliative care in the first place. And we should firsthand be funding that, be funding basic medical services that allow disabled people to live, ill people to thrive, before looking to make it easier to die than it is to live a full life. And until that pressure, that social coercion to end your life because you're a burden, because you're different, because things are harder for you every day socially, until that's gone, we can't think about a bill like this.
I've spoken to a lot of people today, and one of the things that has been raised is kind of something that together obviously we focus on a lot, is the lack of public consultation, and more importantly how the public don't even know this bill's going ahead. What can people who do know about this bill do in order to raise awareness to their MPs, yes, but also to the general public?
It's a great question. I mean, I think that we should all be talking to our friends and neighbours. I can tell you that I haven't won this argument with some of the members of my family, right? So these are the things that go to the core of things. I don't hate them. I love them very much. And it's the same thing with our citizens, right? We need to get better at our own way of explaining things, not call people names, understand their motivation is genuine, right? They're coming to it from a position, and that most people are well-intentioned. I think there are some people out there that are doing some really wacky things, but most people are citizens, fellow citizens, are well-intentioned. Let's discuss these things with them. I know it's tricky, but we've got to get our muscles back in shape in having public discussions that is in a way that doesn't demonise people, say you're evil, but just say, look, well, essentially, try and understand their argument better than them. Because that's always a good first point. Then you know if you're really convinced of your own argument, and engage them in the sense that we'd like to generally win them to this position, right? Yeah. And I think that that can mean giving out leaflets. It can go to cafes. It could be little church groups. It may be down the pub. It may be at a rave. It could be anywhere, right? Going to a festival. Have these conversations, right? They're really important. They're not morbid, because what this is about, life, is a celebration of what's possible and our aspiration. And I think we've become very misanthropic, we've become very anti-human, we've become very, it's all just terrible, fear-mongering, we're mad, bad and dangerous, a disgust, a contempt for the public and for people. And as agency, as humans, it's really where we fall on that. And if you think that your family and your friends and the people you love are good and worth it, then this is a good and worth it conversation, and that's where we should be at, really.
Okay, so it's coming to the end of the demonstration now. What a brilliant event. I mean, the vote has been delayed, but nevertheless the people have come out against the assisted suicide bill. This is something that seriously needs to be looked at, properly scrutinised and properly debated. We've spoken to people from all walks of life, people who are disabled, people who are here just in support of the disabled, and I can tell you the consensus against the assisted suicide bill is incredibly strong, and that's for a reason. We need to be fighting back against this, and we need to be doing it together.